thank you for joining us today for Dr. Victoria Williams' presentation on Black students' mental health in the age of COVID. Without further ado, I'm going to introduce Dr. Victoria Williams. She is the postdoctoral psychological fellow at Clovis Community College. So without further ado, Victoria, Dr. Williams, go ahead and take it away.
Okay. Well, hello, I'm Dr. Williams, and I'm the postdoctoral psychological fellow at Clovis Community College, so what Patrick said. Today, I'll be talking about Black students and their mental health during the pandemic, but also a few other things. So let's get to the agenda, and I will sit down. Okay. All right. Oh, I have this slide. So, all right. So for the agenda today, I'll be talking about the relationship between Black people and diseases, statistics and studies about COVID-19, racial disparities, and risk factors for COVID-19, mental health, the mental health status of our undergraduates and young adults, recommendations for how we can better support our Black students, and coping skills. Okay. It seems like a lot, but it really isn't. So, all right. So, this might sound a little bit tangential, but while I was putting the presentation together, there was a news article I stumbled across from the New Yorker where Evelyn Hammonds, who is Harvard's Department Chair for History of Science, was being interviewed about the relationship history of race and disease, so the intersection of it. I thought it was fascinating, so I thought I would share what I found in the next slide. Also, she had some really good quotes in the article, so I have this one up on the slide. It says, "Epidemic disease always lay bare and make visible inequalities in society." So it's like, who has easier access to healthcare and who doesn't? Who has better resources to get the physical and emotional support they need to overcome, the pandemic if they or COVID-19 if they have it, and who doesn't? Okay. All right. So yellow fever. So let's talk about history and disease. So it's 1793. The yellow fever epidemic is here, and it's in Philadelphia. People started to panic, and they were fleeing the city. Benjamin Rush, a signer of the Declaration of Independence, and he was also a physician and an anti-slavery activist, among other things, believed that Black people were immune to the disease because of their race, and enlisted the help of 3 free Black abolitionists. That was Richard Allen, Absalom Jones, and William Gray, who were part of Philadelphia's free Black community, or the Freed People. Rush urged Allen and his community to stay behind so they could help end the epidemic. And remember, there's no real scientific evidence backing that up. It's all based off of covert and flat out overt racism. Rush told Allen that the disease would simply pass by people of color, so he shouldn't worry about getting it. So Allen, Jones, and Gray agreed to help out and recruited other free Black people to be nurses, cart drivers, and grave diggers. But lo and behold, 240 Black people died of yellow fever, and even Allen contracted it. At that time in Philadelphia, there were approximately 2,000 freed people. So for 240 people to die, that's pretty huge. And then to top that all off, after the epidemic subsided, the Black people who were helping out were accused of robbing the sick people. So can you imagine being at the epicenter of an epidemic or a pandemic and helping others day in and day out, and people are accusing you of robbery literally because of the color of your skin? I think that's nuts. So in order to defend themselves, Allen and Jones wrote a pamphlet, and it's actually online, so people can read it. It's called, and it's a long title. It's called A Narrative of the Proceedings of the Black People During the Late Awful Calamity in Philadelphia in the year 1793, and a refutation of some censures thrown upon them in some late publications. That's the title. In the pamphlet, they state, "To this day, a generally received opinion in this city that our color was not so liable to the sickness as the whites. We hope our friends will pardon us for setting this matter in its true state. The public were informed that in the West Indies and other places where this terrible malady had been, it was observed the Blacks were not affected with it. Happy would it have been for you, and much more so for us, if this observation had been verified by our experience." So, and that's the end quote. So let's just remember, although someone might tell you that they're not racist or that they're an anti-slavery activist, it doesn't automatically mean that they view you as an equal, right? Okay. Now let's get to, let's talk a little bit about smallpox. Okay. Just waiting for the script to catch up. So this spread to the free people in the 1860s at the end of the Civil War. And, you know, the free people were scared, and I mean, rightfully so, because there wasn't only the factor of getting smallpox, but the anticipatory anxiety of scars and how the rest of society would perceive them. If a doctor was coming to treat them of smallpox, was the intention to cure them or to really just observe how smallpox affects a Black person? So this distrust of doctors, that's something we're still seeing today, unfortunately, almost 200 years later. Okay, so anyways, we're back in the late 1800s now, and the newspapers and medical societies are saying that the reason why so many former slaves were contracting smallpox is because they were emancipated. So they're basically saying, if you had stayed a slave, you wouldn't have smallpox right now. And of course, all the physicians are speculating, just like with the yellow fever, that it's because of race, that Black people are more likely to get infected by it. So anyways, the dominant culture began to attribute the emancipation of slavery as the physical decline of the Black body and hypothesized that soon Black people would go extinct. In an urge to get vaccinations for free people, a reporter of the New York Times in 1866 wrote, unless something is done for them, the Negro population of the South will begin to melt away in freedom. Okay. So let's take a quick look now at tuberculosis. So now there's an outbreak in the early 20th century in Virginia where everything is still extremely segregated. So that meant segregated hospitals to take care of Black people who contracted tuberculosis. The Burkeville's Piedmont Sanatorium opened in 1917, and this was where Black people could get treated from tuberculosis as long as they paid $2 per week for a bed. That's $44.91 in today's money. I'm not sure how many Black people were able to afford paying $2 per week. Anyways, white people justified that the reason why segregation was good was, of course, because just like the yellow fever and smallpox stories echoed, Black people are biologically and inherently different from white people and were therefore inferior. Plus, the white Virginians blamed the Black Virginians for the reason why they contracted tuberculosis, stating it was because of an inattention to hygiene and uncleanliness. So the Virginia state senator said that Black people needed to be treated for tuberculosis so that they don't infect white people. And he said in 1922, Negroes wait on our tables, handle our food, both raw and uncooked, nurse our children. When we protect them or cure them, we are doing as much for ourselves as we are for them. So it's like, well, what is this? So it's like this recurring theme of when it's a Black person that gets sick, it's because of their race and being biologically different. But when a white person gets sick, well, it's because a Black person infected them. Well, that's great. And then a Virginian pediatrician, of course, siding with the state senator, says that he believed that Black servants infected white children with tuberculosis. Okay. So everyone should read the next article that I'm going to talk about. It's called Germs Know No Color Line by Stuart Galashoff, like back in the 1980s. And he's talking about the race and diseases and segregation for Black people in Atlanta during the early 1900s. So that's where we're at now. We're in Atlanta, and a lot of the white people think it's okay for Black people to live in squalor, to live in the alleyways, because according to them, Black people were built for that environment. Dr. Bernard Wolf, the president of the Board of Health there, is very concerned about the health of Black people in Atlanta, saying that the Black people and their unhygienic ways affects the city's reputation while threatening the health of white persons. Now, Dr. Wolf, also, this is a little bit of a side note, he didn't approve of lynching because he didn't like mob violence and mob mentality. However, if a Black man was found guilty of sexually assaulting a white woman during a fair trial, Dr. Wolf advised that Black man be castrated by a surgeon from the KKK and then brand the letter R on his forehead or face. Okay, so back to what I was talking about before with the white people in Atlanta accusing the Black people of being unhygienic. I'm going to read a short passage that Galashoff highlighted from the Atlanta Constitution regarding Black people spreading diseases to white people. So I'll just wait for the script to catch up a little bit. Okay. It says, segregated district Negro nurses would still emerge from diseased homes to come into our homes and hold our children in their arms. Negro cooks would still bring bacilli from the segregated district into the homes of the poor and the rich white Atlantan. Negro chauffeurs, Negro butlers, Negro laborers would come from within the pale and scatter disease with the same old lavishness. And to that district would go the clothes of white families to be laundered in environments possibly reeking with filth and disease. The disease germ knows no color or race line, no class distinction, and has little respect for distance when it can fasten on a human carrier. To purge the Negro of disease is not so much a kindness to the Negro himself as it is a matter of sheer self-preservation to the white man. Philanthropy doesn't enter into this battle of life and death. Grim, primitive self-interest, the conservation of the health of the white race is the controlling factor. Segregated or not segregated, one law of sanitation and hygiene for both races, one law applied rigorously and without exception. And any other doctrine means the dismantling of every health safeguard the white man sets up for his own people. That's the end of the passage. So, I mean, it's basically saying that they don't really care about Black people's physical health at all, but there needs to be better sanitary conditions to make sure the Black person doesn't spread the disease to the white man. Okay. So, I'll wait for the script to catch up for a second. I'll catch my breath. All right. So I'm sure many of you have heard of the Tuskegee study of untreated syphilis in the Negro male, which was a 40-year unethical longitudinal study from 1932 to 1972. The study initially involved 600 Black men. 399 of them had syphilis. This study was conducted without any of their consent, which is one of the reasons, many reasons why it was extremely unethical. The participants were just told that they had bad blood, which included having syphilis, anemia, and or fatigue. Those with syphilis were never treated for it, though. However, it's okay because they were compensated by having free medical exams, free meals, and funeral insurance. The study was only supposed to last for 6 months, but like I said, it went on for 40 years. Participants were never given the option to leave the study, and even after penicillin became the treatment medication for syphilis, like in, I think, 1947, it was never given to the participants. So the class action lawsuit suing the researchers of the study resulted in $10 million for living participants and their families, which also included a lifetime of free medical benefits and free funeral services. Okay, and now we're dealing with COVID-19. So let's look at some statistics.
Hey, Dr. Williams, really quick, we do have one question. If you went back to, if we can go back one slide.
Yeah.
Back to the article, Germs, No Color Line. Mm-hmm. The question was, is that by Stuart Gassaloff? Is that from 1985?
It is. Yes.
Got it. Yeah. Thank you.
Yeah, no problem. Yeah, it's everyone should read. It's very informative. Okay. So, all right. Ooh. So worldwide, there are approximately 106 million cases of COVID, 2.4 million deaths, in the United States, and we have almost 27 million cases, 464,921 deaths. And that number probably went up since I updated the PowerPoint 2 days ago. In California, there are 3.4 million cases with approximately 44,440 deaths. And then in Fresno County, we have 91,184 cases, 240 new cases per day, and 1,224 deaths. The U.S. Census Bureau estimate that white people make up 60% of the nation's population. Latinx people make up 18.5%, and then Black people make up 13.4%. And let's remember that number. And then Asian Pacific Islanders make up 5.9%. So a study was conducted back in November by researchers at the Stanford University School of Medicine and Duke University School of Medicine. And they found that in their sample of 7,868 people of different races and ethnicities, the Black and Latinx population made up for 58% of all patients hospitalized and 53% who died from COVID-19. Dr. Fatima Rodriguez stated, "We need to invest in communities to increase opportunity for healthy lifestyles and good health care. Structural racism, we know, is a major roadblock for preventing good health." Exactly. So race isn't the problem. It's racism, it's discrimination, it's environmental conditions, it's the ongoing oppression. Okay, so here's just a chart of COVID-19 cases, hospitalizations, and deaths by race and ethnicity. And this is from the CDC. So as you can see, compared to white people, there is 1.4 times as many cases as COVID, 3.7 times as many hospitalizations, and 2.8 times as many deaths, unfortunately, for African-American Black people. And the racial disparities might tell us why. The Kaiser Family Foundation basically did like a meta-analysis with preliminary Medicare COVID-19 data and found basically also what the CDC found too, which is that ethnic minorities are at higher risk of infection and hospitalization, particularly people of color in nursing homes, Latinx and Black pregnant women, and Latinx and Black children. Testing sites in these neighborhoods may have a greater demand than those near predominantly white areas, resulting in longer wait times, and there may also be an increase in travel time. Maybe someone is also afraid of losing their job, or they're not getting time off to get tested too, and that can also be very stressful. And then when compared to the dominant culture, ethnic minorities may struggle with not having any health insurance, might come from a lower socioeconomic status background, and have difficulty obtaining health care. Okay, so just overall, the possible racial disparities that we're seeing is the limited access to health care, overcrowding in the house, chronic health conditions. And then in one study that CDC did, they found that 90% of the people hospitalized with severe COVID-19 had an underlying health condition, such as heart disease, lung disease, and diabetes. Other disparities is ethnic minorities being essential workers, and then stress and immunity. So let's get to the next slide, and I'll talk a little bit more about that. Okay, so right now, you're a Black college student in the Central Valley, and there's a pandemic, and everything's online, and you're all zoomed out, and you're staring at the screen for hours on end. You're watching the news, and it seems like there's a new story on police brutality every month, or every week even. If you've been discriminated against, and I know I've been, or if someone was being microaggressive or, basically subtly racist towards you, you carry that with you. And you might not carry that on a surface level, but you can carry it below the surface level. So you have all that going on, plus trying to pass all of your classes as a part-time or full-time student, plus dealing with family and maybe taking care of kids, plus maybe having a job. So that's a lot. So, where does your mental health fit in? And that's why at the bottom of the screen, it says self-care is small and hiding in the corner. Oh, that means I go to the next slide too. past studies have shown that compared to their white counterparts, Black people face significant mental health issues during crises, such as an epidemic/pandemic and natural disasters. And these symptoms include depressive symptoms, social isolation, and a sense of collective grieving. So when George Floyd was killed on May 25th, 2020, as a Black community and also the rest of the world, we were also grieving along with Floyd's family. So getting help for medical or mental health issues, I know that's not easy, especially with the stigma behind mental health and what I talked about earlier with this perhaps like this conscious and unconscious distrust of healthcare providers. However, we all know that Black people are always resilient. We always bounce back. And we can bounce back through church, our spirituality, maybe through talking to a mentor or talking to friends. But being in the psychology field, I know how important it is for people to seek help for their emotional well-being. Diversity trainings for mental health professionals to be culturally sensitive and competent is a lot more prevalent right now. That's a good thing. So I know that going to therapy might not be your first option, but it's a really good option. And I encourage anyone that's struggling to reach out and take that opportunity to get help. And then specifically for SCCCD, if you pay $21, the $21 health fee each year, you can get free psychological services. That's up to 6 individual therapy sessions with psychological services. So don't be afraid to reach out because your vulnerability is actually a strength. Okay. So here are some things that you can do for your mental health. So stay connected with family and friends, whether it's through FaceTime or if you are living with some family members or your significant other. Do some journaling. So, you could keep a dream journal. You could keep a manifestation journal where you're kind of putting your goals and dreams onto a journal to make it feel more realistic. Or, you could just have a journal talking about your mood or what you ate, yesterday, something like that. Always, talk to someone that you trust. So like I said before, maybe talking to an instructor or a mentor. Always remember to exercise, right? And, that also helps with reducing anxiety. And then also just, I'm sure people read a lot of articles that are upsetting to them or stressful about, police brutality or, current socio-political events. So just, consider the source in any of the articles that you read. You can also join a support group. So right now, I facilitate Comfort in Chaos. It's a group therapy. It's for all students in the SCCCD district. So it's basically just general group therapy. So you get to talk about whatever you want and there's no judgment. And then I also facilitate the Justice and Healing Talking Circle for students. And that's, the Comfort and Chaos group is every Thursday at 3:00. So that's happening right after this. And then the Student Justice and Healing Talking Circle is every Wednesday at 3:00. So if you're interested in joining either of those groups or any of the group therapies we have, just email me at victoria.williams@cloviscollege.edu. And then some other things for your mental health. So just try and stay organized. I don't know if that means buying a calendar. Honestly, that doesn't work for me. Maybe having a student planner. And then if you're writing down a list of all the things you need to do, try to just write down 2 to 3 things that you can accomplish. Because for me personally, if I write down 20 things, it's too overwhelming. And then I don't even want to look at the list. Make sure that you get enough sleep, right? That's always important. And then, you can also try some progressive muscle relaxation, which I guess I can do a little bit of that now so people know what I'm talking about. It's basically tensing up and isolating different parts of your body while you're doing deep breathing, and it's supposed to help reduce your anxiety. And you could do it anytime, right before you go to sleep, so you don't have those mind racing thoughts if you do experience anxiety, or maybe before a presentation like this one, or really just any time. So I guess I'll start that right now. So if everybody that's listening can just put their feet on the ground just to, make sure that you're grounded, and just, you could put your hands on your legs, on your lap, and just kind of get comfortable, and maybe sit upright and just close your eyes. And I guess maybe I'll close my eyes too. So right now, I just want you to inhale through your nose and exhale through your mouth. So if you just inhale, take a deep breath, hold it for like 5 seconds. 5, 4, 3, 2, 1. And then exhale through your mouth. And then we'll do it again. Inhale, take a deep breath. Hold your breath for about 5 seconds. 4, 3, 2, 1. And then exhale through your mouth. And now this next time when you take a deep inhale, just scrunch up your toes really, really tight. So inhale. Scrunch up your toes. Hold it for 5 seconds. 5, 4, 3, 2, 1. Exhale through your mouth and release the tension in your toes. And we'll do that one more time. Inhale through your nose. Scrunch up your toes too. Hold your breath for 5 seconds. 5, 4, 3, 2, 1. And then exhale through your mouth and release that tension. And now we'll take it up to our shoulders. So let's, while we're inhaling, let's shrug our shoulders and make sure our shoulders reach our ears. So inhale, scrunch up your shoulders, hold it for 5 seconds. 5, 4, 3, 2, 1. Exhale through your mouth and release the tension in your shoulders. And then we'll just do it one last time. So inhale through your nose. Scrunch up your shoulders really tight while you're doing so. Hold it for 5 seconds. 5, 4, 3, 2, 1. Then exhale through your mouth and release the tension in your shoulders. And then when you're ready, you can open your eyes. And I hope that worked for someone. But that's just something that you can do anytime, no matter where you are. If it's like clenching your fists or like tightening up your abdomen. So it can work. So, all right. So let me get to the next slide. I think we might be at the end. Oh, yeah. So we are at the end. So I'd like to know if people have any further questions or comments, and what everyone is doing for self-care. And, if I don't know the answer to your question right now, you can message Patrick your email address, and then I'll get back to you with the answer. Okay. So thank you.
Thank you so much, Dr. Williams. That was very, very informative. And we do have some questions that have come from the chat. The first question that have been sent to me in the chat, the first question is, for our Black students who are showing a lot of stress, what do you suggest to help them?
Yeah, that's a really good question. So kind of like, I feel like back to one of the other slides of talking to a mentor, if someone is religious or spiritual, maybe talking to their pastor, being around other people at church could help. And then also, I think, I've been facilitating the Student Justice and Healing Talking Circle for this past year. And I think it's a really good, safe space for people, Black students and students in general, just to, share how they're feeling, and then their thoughts about everything that's going on in the world. So definitely email me if you'd like to join that. So, and then, I also do the employee talking circle too, if people are interested in joining that and their employees.
Thank you so much. We have another question as well. How do we help students overcome the barrier of not wanting to ask for help because it shows weakness?
That's a really, really good question. I feel like that's a loaded question because I think there's a lot of different factors and like layers that go into it. So I don't know. Sometimes I feel like a student almost needs to, if a student really doesn't like asking for help, and I'll admit that I've been one of those people where like I just want to do everything myself and I don't need to ask anybody for help. I don't need people. But it's like you kind of get to a point where you're like, oh, like I'm feeling burnt out or I'm feeling overwhelmed. Like I need some help. So sometimes it takes getting to that point to ask for help. And that's okay because now you're at a place where you want to ask for help. I think it's also good for instructors to just, I guess, virtually tell their students like, hey, if you're experiencing any stress or any burnout or, if anything that's been going on with you or just with the world is bothering you, know that you can talk to me or I can give you resources. So that might be another way to help students, feel less weak about being vulnerable. And like I said before, really, and something that I tell my clients is, to me, being vulnerable is having emotional, like, inner strength. And that's something it's hard for people to do, but that's why it's a skill. That's why it's really a strength and not a weakness. So I hope that answers that person's question.
Thank you so much. And then another question that we have is, I know that you mentioned just a little bit of it in your slide, in one of your slides. Can you just go over some of the services that are offered by Psychological Services on campus?
Oh, yeah. So we do. So what we're doing right now, since it's virtual, so for example, like a postdoc like me at Clovis, I could see someone at Madeira or I could see someone at Reilly over Zoom. That's to help like prevent from being a wait list. So we go by the brief teletherapy model. Not teletherapy, just regular therapy. But that's 4 to 6 sessions per student. And then they get 2 to 4 follow-up sessions the next semester. It can be long-term if needed. It just depends on the case. And then we start the student off with, so they need to go to the Psychological Services at their designated campus online, and they can fill out the online request form. And then about within a week, they'll be contacted by a clinician. And then the first session is the triage. So that's the initial screening. And that takes about 25 to 30 minutes. So that's just getting to know more about the student's relevant background history and their presenting problem, why they're in therapy. And then the actual therapy starts the next session. So we do the individual therapy. We can do couples therapy too, as long as both of the students are registered with SCCCD. And then we also have different group therapies. So we have group therapies on anxiety. We have it on art and like expressing yourself through art. We have it with social skills and like how to start and maintain a conversation with someone or how to make friends with someone. We have comfort and chaos, kind of what I was talking about before, which is really, I'm very laid back. So it's just general. You could talk about, whatever you want. It doesn't matter to me. And then we have a group for parents, for moms, and we also, and then I do the talking circles for students. So if you are interested in joining like any of that, just email me. And then today we even have at 6 p.m. there is a love language outreach event happening on Zoom. So also if you're interested in that, email me. And I'll send you the flyer for that.
All right. Thank you so much. And then another question that we have here is, how can we create spaces, culturally minded spaces that honor culture and self-care in our online classes?
I think that's a really good question. Maybe that could be part of, like, I'm just putting, it's just an idea that I just made up right now. Maybe like during office hours for instructors, like that could be that culturally sensitive safe space, maybe for people to talk and to talk about that. I'm trying to think. I don't know, just collaborations, like students collaborating with the instructors to also, to ensure that it's a safe space too. So I don't know, maybe that's something that the instructor can talk about at the beginning of each semester. Like, how can I make this a safe space for Black students? I don't know if that answered the question at all. I'm so sorry.
Thank you so much. And can you remind everyone, for anyone that's on the Zoom call right now, or anyone that may watch this video later, when the Student Justice and Healing Circles are again?
Yeah, the Student Justice and Healing Talking Circles are every Wednesday at 3 p.m.
Thank you so much. And can you remind everyone when the Employee Justice and Healing Circles are?
Yeah, the Employee Justice and Healing Talking Circles are on Wednesdays at 12 p.m. And for the students with that talking circle, like I said, if you're interested, please email me and I will send you the Zoom information for it.
Thank you so much. Are there any more questions? If you have another question, feel free to put it in the chat. Outside of that, thank you so much, Dr. Williams. Any last comments or anything else that you want to leave with all participants and people viewing the video?
Just that it's never too late to reach out and go to therapy.
All right. Any more questions at all? If not, thank you so much for joining us today. Really, really appreciate it. We do have a full slate of events next week, including Dr. Chike Akua speaking on Wednesday. We have Dr. Patrick Fontes speaking on Thursday. And then we have our HBCU panel on Friday. So again, please visit our website as well, cloviscollege.edu, and the very first banner on our website will be our Black History Month events banner. So just click on that and it will take us to our landing page. Again, thank you so much, and we hope to see you next week.